Welcome to the Nutrition Research Update from the Renaissance Institute of Integrative Medicine. I'm Dr. James Meschino. Our topic today is preventing recurrent urinary tract infections. You know, after the common cold, the second most common health condition that accounts for visits to doctors' offices are urinary tract infections. In fact, about 9 million office visits each year in the United States are attributable to urinary tract infections. So, of course, the common symptoms and signs of urinary tract infections include a burning sensation when you urinate, the feeling the need to urinate more often than usual, or feeling the urge to urinate but not being able to do so, and having sort of cloudy, dark, smelly, or bloody urine. Now, in elderly patients, this is an exception. Sometimes none of these symptoms are present. However, you would suspect a urinary tract infection in an elderly individual who has a fever and just personality changes, but with no other symptoms. And they might have these cognitive changes in someone who normally is not known to have any cognitive problems. So that should be investigated. They should have a urine sample should be done to see if they have a urinary tract infection. A fever of sort of unknown origin and or personality changes that just sort of come on suddenly. Now, women tend to have urinary tract infections more often than men because bacteria can reach the bladder more easily in women. So the basic steps for women to prevent recurrent urinary tract infections include these. Drink more water to help flush the bacteria through the urine. And don't hold it in when you need to urinate. You know, you need to urinate when you need to urinate. Wipe from front to back. Take showers instead of baths. Always wash the genital region before and after sexual intercourse. Wear panties with a cotton crotch because the cotton fabric lets moisture escape. Moisture is a breeding ground for bacteria. And avoid feminine hygiene sprays and douches. Now, on the nutrition side, taking vitamin C, taking 500 milligrams of vitamin C twice a day, 1,000 milligrams a day, as you can do from a good high-potency multivitamin, it increases the acidity of the urine, and when the urine's more acidic, it's much harder for those bacteria to replicate. You should also take a supplement each day, twice a day in fact, that contains proven dosages of cranberry extract and a simple sugar called D-mannose. So cranberry extract contains these active constituents that have been proven to decrease the ability for the bacteria to adhere to the wall of the urinary tract. And these constituents also help to acidify the urine so that the bacteria cannot replicate so easily. But again, with cranberry extract, it needs to be the right dosage and the right standardized grade, which you'll see in the text below this video. D-mannose is a simple sugar that the body cannot metabolize, so there's no calories there. It basically gets filtered through the kidneys into the urine, and when it does that, it acts like a slippery glove around the bacteria so their tentacles can't stick to the walls of the urinary tract so easily. Then when you urinate, you flush the bacteria out. It's been shown to be very effective. So bacteria lose their grip, and each time you urinate, you're basically flushing the bacteria out of your body. Now, because E. coli bacteria are often the primary culprit in urinary tract infections, and they have these types of tentacles, this is a very effective strategy to help get them out of the body. It's a stubborn little germ. It grips to the walls of the urinary tract with its little tentacles like suction cups. So the bottom line is that these E. coli bacteria are very hard to eliminate, even with the use of antibiotics. But if you have a urinary tract infection, you do need antibiotics to kill the bacteria. It can be, if you let it go, it can become very serious, lead to sepsis, and can be even life-threatening. So you've got to kill those bacteria. But even when you're taking the antibiotic, I can tell you it's not going to kill every last bacteria. That's the problem. So the bacteria that remain will cling to the walls of the urinary tract and slowly over time multiply and get you ready for the next episode. That's why it's such a difficult thing. That's why there's recurrent problems. So this is why D-mannose is such a good supplement. At a dose of 500 to 1,000 milligrams a day, it prevents the bacteria from gripping to the walls of the urinary tract so you can flush it out during urination. So my recommendation is to take a combination supplement that has the right dosage and standardized grade of cranberry extract and also contains the D-mannose. At the effective dose and standardized grade, it's a fantastic 1-2 punch combination that's been shown to decrease the recurrence of urinary tract infections. Now in the text below, you'll see the exact nutrition and supplementation and lifestyle plan that's been shown to help reduce recurrent urinary tract infections. If you've been bothered by them in the past, I suggest that you adhere to the advice that you're seeing. If you know somebody who's had urinary tract infections on some level of frequency, you might want to just forward this nutrition research newsletter to them. So I hope you found this informative. Thank you for watching, and I'll see you next time.